Hello. Thank you for joining us this morning. We'll start our presentation momentarily.
Good morning, York. Welcome to our Impact 20 discussion. I'm Jane Conover, President of the York County Community Foundation. First, let me start by sending out my sincere wishes for your good health and well-being, and to thank you for joining us on this beautiful sunny morning. Impact 20 is a live 20-minute update to share high-impact initiatives happening in York County. Today, we are talking about how our community is coming together to provide charitable gifts to support those that are impacted by COVID-19, and how we are working with our nonprofit partners to respond to those needs. This work aligns with YCCF's mission to inspire charitable giving and use our expertise and our grant dollars to create a vibrant York County. YCCF exists because hundreds of generous donors have created charitable funds with us that generate over $6 million a year to support the charities that matter to them most. YCCF is also a catalyst for bringing people together to solve community problems. We seek to strengthen the community services and ultimately make the system work better for all York Countyans. It's complex work, and it takes commitment on common goals, mutual accountability for actions and results, and above all, it takes trust. And that's exactly what is called for as we face the health and economic impacts of COVID-19. In March, we convened our colleagues at the United Way of York County and our private foundations to launch the York County COVID-19 Response Fund. It started with a grant from YCCF's Fund for York County of $100,000. Now there is over $1 million available in the fund, thanks to hundreds of generous donors. Thank you so much for supporting your neighbors in need. You can learn more about the COVID Fund at YCCF's website and the United Way's website. Today, we're going to focus on the philosophy of grant making from the COVID Fund and how it is having an impact on people's lives. I'm joined by Lise Levin, Vice President of Community Investment at YCCF, and Natalie Williams, Vice President of Community Impact at the United Way. They are partnering with Jessica Mockabee, who is the Vice President of Human Services at York County, and they are leading and spearheading the grant-making effort of the COVID-19 Fund. Thank you so much, guys, for all your excellent work on this critical project. We're going to ask those folks some questions, have a discussion, and then you can also ask questions by using your chat feature in the Zoom box. I'll start with you, Lisa. What are the grants being used for from the fund, and how did you figure out what to focus on?
Thank you, Jane. When this first started, we reached out to our colleagues in other communities to learn. We actually reviewed over 50 other communities' COVID funds, and many were partnering with their United Ways to do the work. So that was a first lesson right there. We also joined with the White Rose Leadership Institute here in York and our United Way to survey and learn from our own nonprofits about what they were experiencing on the ground. And this was very early on in this process. So virtually every community foundation across the country is focusing on immediate needs like food security and housing security. And here in York, what we're discovering is that calls to our PA 211 line are way up. With between 40 and 60% of their calls now related to the pandemic. And food and rental assistance are by far the top two reasons that people are calling there. 55,000 people are food insecure in York, and 138,000 people in York County filed for unemployment in March and April. That's 30% of our community. And while we've always had food and housing insecurity, there's a new group that is being impacted by the pandemic. United Way calls it ALICE, which stands for Asset Limited, Income Constrained, Employed. And these are working families who have been living paycheck to paycheck and who are struggling to get by, and they haven't been able to save, and now they're out of a job. And that's really the focus of a lot of our response fund work here in York.
Thank you. Yeah, that's impressive. The 211 line, by the way, is a phone number anyone can call for information and get services or referred to services anywhere in the York County area. So remember that number. A best practice for grant makers is to not make any grant decisions in a vacuum. So you're involving nonprofits and on advisory committees. Natalie, can you tell me more about why you set it up that way and how you decided which organizations to participate? Oops, Natalie, you need to unmute.
Sorry about that, regular Zoom faux pas. So for us, it really is not just about the grant making, but it's about how do we collaborate in a way that's collective and we're working together and not in silos. So that allows us to kind of target our efforts in a better way. Lise, Jess, and myself, we're very lucky to work with some extraordinary nonprofit partners through our organizations. And so we're lucky that we have the ability to bring those people together to understand, service delivery models in the community and have a greater impact. We obviously had to bring those advisory groups together to determine kind of our common agenda, right? And have some agreement on the fact that we didn't want families to have to worry about where their next meal was going to come from. We didn't want them to have to worry about whether or not they're going to lose their housing as a result of the pandemic. These are all of the things that really are stable to a life and necessary to life to be successful. So the food group, the seat at the table, started to work in 2017, and they have been working towards a common agenda, of obviously dealing with food insecurity and the delivery system. Our housing group, started really with this COVID response fund and bringing together our partners for our housing advisory group. And why did we do this? So that we could have better outcomes, and that their collective knowledge allows us all to craft smarter strategies. We also wanted to ensure that in every single conversation that we have, that we're continuing to have outreach to communities that are underrepresented, and use our networks, all of our networks, to leverage additional expertise. What we've really been impressed with is the ability of these advisory groups to be honest and transparent. And ultimately, we're all working towards the better good of the community and keeping our organization's needs really behind us and really focusing on the impact of this response fund.
Mm-hmm. Yeah, it really has, you have demonstrated how working together really makes your impact even stronger. So that's one of the best practices about community problem solving. And I'm wondering, Lisa, if you can tell us more how you think that collective model is really helping your outcomes be stronger and the project being stronger.
Yeah, we've been talking about best practices for systems change for a while now. None of us ever imagined that we'd be sort of vaulted into working this way so quickly as a result of the pandemic. And again, it's a real tribute to the community that they've come together so quickly to work this way. So, a common agenda really started when the funders and the donors all came together and said, we trust the United Way and the county and the community foundation to disperse grants from this fund, and we're going to support it. So that $1 million+ was a really huge milestone. Of course, the food group's agenda, it could have gone a lot of different ways, but what we're really focusing on is to get the most pounds of food to the most households across the county. So that means we're granting to big and small pantries that reach into all corners of the county for tons of food, for refrigeration, for pop-up food distributions in underserved areas. And I'm really proud to say that more pounds are being delivered and distributed in York's charitable food network than any of our 26 neighboring counties. It was over 1 million pounds of food in April alone. For housing, we're grounding to help people countywide learn the survival budgeting skills that they need to pay their rent. And we're helping them with housing assistance if a gap still remains. And these are people, remember, who typically don't have access to traditional rental assistance because of their income level. So this is a new group of people. And the focus is to help people who are impacted by the pandemic get through it. And as Natalie said, remain stable on some of the most important stability issues there are, food and housing. Another best practice, we're all using shared measurement. So every grantee is measuring their impact in exactly the same way, and they're sharing their outcomes every month so we can learn from each other. And again, people have been very honest about what's working and what isn't, and that's really important because we have to remain nimble in this brand new environment and sort of make changes on the fly in response to what's working well and what's working not as well. Another best practice is what's called mutually reinforcing activities, and the housing strategy, which the advisory group designed, is a great example of that. So, for example, we have a communications campaign, a very robust push out of information to direct people to a website, but also to tell them how they can stretch their dollars. The website points them to additional places they can go to learn how to further stretch their scarce money, and to also work out payment plans with their landlords. There's a lot of tools and support for that. And if they're eligible, they can even get gap rental assistance to avoid eviction. In the meantime, we're also working with a group of landlords directly to try to work with them to keep their tenants safely housed. Continuous communication is really critical to this work. We hold regular meetings with our various advisory groups at least every week or two, and we have a lot of conversations in between. We have to be 100% honest with each other throughout this process. And really the great thing about these advisory groups is that they're so focused on the common good and not on what benefits their organization. Many of them are not even grantees or eligible to be grantees, but they're showing up and making time out of their busy schedules every week, every 2 weeks. And these are executive directors of big organizations in town, and we could not do this work without them. The final best practice I would sort of want to highlight is what's called backbone support. You need to have a person or an organization that's charged with keeping the group focused. We have to be able to air issues when they arise. We have to make sure that everybody gets heard, and we have to keep the group moving forward together. With the food group, Central Penn Food Bank is playing that role. And in the housing group, because it's a less formal structure, Natalie has really been keeping us all focused and on track.
Yeah. It sounds like we're really building muscles that are going to last well beyond this crisis response. You know, how do we build on this to really help address all kinds of community issues coming up? And so Natalie, can you give us some examples of how people have been impacted by the grants that we've been giving out? How much have we given out so far?
We have distributed $242,000 so far for the months of April and May, and we're working on a monthly cycle where we're evaluating grant outcomes and then allowing organizations to obviously ask for additional funds to do this really critical work. We are hearing a lot of stories from our grantees, and we really do kind of start with that moment every time we have an advisory group meeting. We really ask, what are you seeing? What are you hearing? How is this affecting the community? Understanding that we all need to hear those stories to really have that true impact. And so, you mentioned Jane 211. We've talked to our local 211 representatives and really have said that a lot of the calls that they're receiving are people who are asking for help that have never asked for help before, that are not familiar with services that are available, but are just so happy to talk to somebody to understand that there's organizations out there that are willing to help them. we have been in the housing piece, we've been hearing about individuals who are calling to say, you know, I'm really concerned that I'm behind. I need help talking to my, you know, my landlord. I need help figuring out how to access some of these public benefits. I need help really looking at my household budget in a different way. And so those calls have already started to begin way before we got this COVID response fund started, but they're really starting to ramp up now. You know, over 35,000 households have accessed over 1.8 million pounds of food. And one of the most enlightening stories or heartwarming stories that we've heard is, you know, a family who really is living paycheck to paycheck and doesn't have a safety net, never needed help for their family before. You know, uncertain about waiting in lines at, you know, a food bank delivery during the day. When they pulled up and saw that smiling volunteer or staff member, you know, they opened their trunk of food, opened their trunk for a box of food that will help their family for over a week. And, you know, people are kind and they want to pay it forward. So this lovely gentleman reached out and gave $2 to a food bank volunteer, you know, just to try to pay it forward. And so really it's about community, it's about us coming together. And those are just a few of the stories that we've heard as a result of this work around the COVID response.
Mm-hmm. Mm-hmm. Yeah. Yeah, and then we really want to again thank our donors and for helping to change people's lives and giving them a bridge really to whatever comes next. Some will get jobs back, some may not get jobs back. So Lisa, can you tell us what the groups are thinking about in terms of what's next in terms of grant making and how this may evolve over the next few months?
Thanks, Jane. You know, we have to look at sort of these short-term, mid-term, and then long-term needs. So we can pivot from response, which is what the funders sort of entrusted us to focus on, and then to recovery. And again, our funders and donors are allowing us to be really flexible with that. So we're really listening to our nonprofits here in York. There's some surveying work now going on around that. We're also really closely following the work the county is doing with its recovery plan as a whole, because we want to align and not duplicate our work together so that we can help as many people as possible. Across the county, in addition to food and housing, we're looking at what other community foundations are focusing on, and they're looking at things as varied as childcare, support for small businesses and nonprofits, and reemployment. And so we're watching their work closely to learn from them, and we want to bring what is the best of what's going on in other communities here to York.
Mm-hmm. Yeah, good point. Yeah, I know that the Community Foundation just agreed to support a loan fund, a grants / forgivable loan fund for small businesses in York County, and so you'll be hearing more about that in the coming days. So we're about to wrap up. Is there anything that you forgot to say that you'd like to add, or Sarah? Let us know if there are any questions from the audience.
Yeah, Jane, I'd like to add that, you know, I think one unique thing about the fund and the work that we're doing is that, you know, our nonprofit partners on our advisory groups, myself, Lise, and Jess, are really tied into public monies that are coming to the community. And so what we're doing is really not trying to duplicate those dollars, but really shine a light on them. And so we are trying to craft this response you know, in a way that it doesn't duplicate those public funding dollars. Money is coming to the community. It's never going to be enough, but we feel as if this fund really can benefit and highlight what those funds aren't able to do. And so I think that's really important that we've been really focusing on as well.
The other thing I'll mention that I've been noticing is that, as we know across the country and in this community, that this has highlighted disparities in people's access to healthcare, access to information and resources, and how some people are afraid of using the system. And so I think that's also something that we want to make sure we can work on over time to reduce those disparities. There is much more information about the COVID Response Fund on the YCCF and the United Way's website. So please feel free to check out those websites and contact us if you have any inquiries. Again, I want to thank our donors for supporting this fund and helping us be able to make a difference at this really critical time in our community. So thank you for joining us today. Have a wonderful day.